Hey everyone, and welcome back. We're diving into a topic that's absolutely crucial for all you future nurses out there.
Oh, absolutely.
Asthma self-management.
Yeah.
We've got a ton of great nursing education materials and expert insights to dig into.
We do.
And our mission today is to give you the knowledge to help your patients live their best lives.
Right. And you know what's really interesting to me is how asthma is often seen as this reactive condition.
Yeah.
You only treat it when symptoms flare up.
Right.
But the real magic happens when you shift that focus to proactive management.
So it's less about putting out fires and more about preventing them.
Exactly. The ultimate goal is to help patients live a life that's unrestricted by asthma.
Okay.
A life where they don't have to constantly worry about the next attack.
Right.
They can do all the things they enjoy.
Right.
Without limitations.
Yeah, that makes total sense. And our sources really emphasize that impact. Self-management leads to some amazing improvements in patients' lives.
Oh, for sure.
It's not just some vague idea.
Yeah.
You see fewer ER visits.
Right.
Fewer hospitalizations when patients actively manage their asthma.
Yeah, and I've seen studies reporting a 50% decrease.
Wow, that's incredible.
It's huge. And it really highlights why this is so important for you. As future nurses, you're not just, giving meds and treatments. You're equipping patients with the skills to manage their own health.
Right.
That's true empowerment.
So how do we actually get patients to that level?
Well, one of the most essential tools is the Asthma Action Plan.
Okay, I've heard of these, but honestly, they always seem kind of like just another piece of paper.
Yeah.
How do those actually translate into real action?
It's all about clarity and empowering that patient to make their own decisions.
Okay.
So think of the Asthma Action Plan like a roadmap, but instead of streets and landmarks,
Okay.
it's got zones based on their breathing and symptoms.
I see.
Green, yellow, and red.
Okay.
Each zone tells them exactly what to do based on how they're feeling.
So imagine it's 3 a.m.
Oh,
The
yeah.
patient wakes up, can't breathe,
Right.
panicking.
Of course.
A clear plan in that moment could be life-saving.
Absolutely. And you, as their nurse, you're crucial in making sure they understand and use it.
Right.
You'll be walking them through it, teaching them how to recognize those early warning signs.
So they can act before things get out of control.
Exactly. Think of it as preventative care.
I like that. So what are some of those early warning signs nurses should be teaching their patients about?
Well, let's talk about asthma exacerbations, but instead of just listing symptoms,
Okay.
I want you to really picture this.
Right.
Your patient says they've been coughing more, but they're brushing it off.
Right.
But you, with your knowledge, to dig deeper,
Okay.
ask about wheezing. Check their peak flow.
And by doing that, you could catch a serious problem early.
Exactly. Preventing a full-blown crisis.
Wow, that's powerful.
It is. That's where understanding quick relief meds becomes crucial.
Okay.
Like your SABAs,
Sabas.
short-acting beta agonists, things like albuterol inhalers.
Right.
These provide immediate relief by relaxing those muscles around the airways.
So they're like the first responders.
Exactly. But knowing when and how to use them correctly is key.
Absolutely. And this is critical for nursing students, right?
Yes. Teaching proper inhaler technique is as important as handing over the inhaler itself.
So it's not just a quick, here you go, see y'all later.
Right.
You got to take the time to explain, demonstrate, and make sure they really get it.
Exactly. Now, while those quick relief meds are crucial for acute situations,
Okay.
long-term control is equally important.
Gotcha.
That's where inhaled corticosteroids, or ICS, come in.
I know some people hear steroids and they kind of freak out,
Right.
but these aren't like anabolic steroids.
No, not at all.
They target that inflammation in the airways specifically.
Exactly. Think of inflammation as the root of many asthma symptoms.
Okay.
ICS help prevent those symptoms from even flaring up in the first place.
So it's getting ahead of it.
Right. And here's the thing. A lot of patients think they can just stop their ICS when they feel better.
Oh, I can see how that would be a problem.
It's like watering a plant and then stopping once it starts to bloom.
You got to be consistent.
You got it. You as their nurse can help them understand that consistent use is key.
So we've got those quick relief meds for immediate action and ICS for long-term control.
Yes.
What other tools can help patients manage their asthma?
Well, peak flow meters are fantastic for monitoring lung function.
Okay.
They might seem simple, but they provide valuable info for both the patient and us.
Break that down for me.
Okay, so they measure how fast someone exhales,
Right.
but how does that translate into managing asthma?
Yeah.
Think of it like this, a peak flow meter is like a speedometer for their lungs.
Perfect.
By monitoring those readings, they can spot those early warning signs of a flare-up.
So even before they start feeling symptoms.
Exactly. That's the power of self-monitoring.
It's about being proactive.
Yes. And you, as their nurse, will teach them how to use it, interpret readings, and what steps to take.
It's like they become their own health detectives.
I love that analogy. And those readings are also helpful for us.
How so?
To assess their asthma control and adjust their treatment plan.
So everyone wins?
Exactly. The patient gets insights, the healthcare team gets data to guide treatment.
Now let's shift gears a bit and talk about those sneaky asthma triggers.
Oh yeah, the usual suspects: dust mites, pollen, mold.
All those allergens lurking everywhere.
Right, but it goes beyond just those obvious ones.
Okay.
Things like exercise, cold air, even stress can trigger an episode.
So it's not just about avoiding dust bunnies.
No, it's about understanding the full spectrum of triggers and how they impact each person differently.
So very individualized.
And this is where your nursing skills shine.
Okay.
It's not about lecturing patients.
Right.
It's about working with them to identify their specific triggers and come up with strategies to manage them.
A more collaborative approach.
Exactly, because asthma isn't one size fits all. Each patient's experience is unique.
I think this highlights the emotional impact of asthma.
Oh, absolutely.
It's easy to get caught up in the technical stuff, but living with asthma can be really stressful.
You're right. Imagine that constant fear of an attack, the frustration of having to limit activities,
Right.
the worry about ending up in the hospital.
And for some people, it affects their self-esteem and social life,
For sure.
especially younger patients who might feel self-conscious about using their inhaler in public.
It's tough. And as nurses, we need to be sensitive to those emotional needs.
Right.
It's not enough to just ask about their breathing.
We got to ask how they're feeling.
Exactly. Create that safe space for them to open up about their fears and frustrations.
And sometimes just listening can make all the difference.
Active listening is so powerful. And remember, you don't have to have all the answers.
Right.
If they're struggling emotionally, connect them with the right resources.
Like therapists, counselors, support groups.
Exactly. There's a whole network out there.
And connecting with others who understand what they're going through can be so helpful.
Absolutely. Support groups can provide community, reduce isolation, and offer coping strategies.
So we've talked about the physical aspects,
Mm-hmm.
but we can't forget that emotional component.
It's crucial for holistic care.
We've covered a lot in this deep dive so far.
We have.
Self-management,
Mm-hmm.
the action plan,
Yep.
different zones of control medications.
Mm-hmm.
And one theme keeps coming up for me:
What's that?
the power of knowledge as nurses. The more we know, the better we can guide and support our patients.
I couldn't agree more. Knowledge is the foundation of good asthma care.
It makes us better educators,
Yeah.
advocates, partners in their health journey.
Exactly.
And it's not just about memorizing facts for a test.
No.
It's about connecting those facts to real people, real situations, real lives.
It's about turning that knowledge into compassionate, patient-centered care.
So let's bring it all together.
Okay.
We talked about the importance of self-management,
Mm-hmm.
the asthma action plan, those zones, different medications.
Yes.
And the big takeaway for you future nurses is this:
Okay.
you're not treating a disease,
Mm-hmm.
you're caring for a person.
Beautifully said. And that person deserves to live a full, active, happy life despite their asthma.
And you, as their nurse, can help make that happen.
You're absolutely right.
So go out there, be those asthma superheroes armed with your knowledge, your compassion, and a whole lot of peak flow meters.
And never stop learning. New discoveries and treatments are emerging all the time.
Stay curious, stay up to date, and you'll be amazing asthma nurses.
Now, remember that question we posed earlier?
About designing the perfect asthma education program.
Yes. Hold on to that thought,
Okay.
because we're going to explore it further in our next episode.
Wait, there's more.
Oh, there's always more to learn. So until next time, keep breathing easy and stay curious.
Catch you later, future nurses.
Bye, everyone. And remember, you're going to be guiding these patients, so let's dive into helping them manage their triggers.
Okay.
It can feel like detective work sometimes.
I like that. So we got to put on our Sherlock Holmes hats.
Precisely. You'll be working with them to identify those things in their environment that set off their asthma.
Right.
Could be anything from those common culprits,
Right.
dust mites, pollen,
Yeah.
to less obvious ones like pet dander mold smoke, even strong perfumes or cold air.
I was reading that even exercise can be a trigger for some people.
Absolutely. Now, the goal isn't to make your patients live in a bubble,
Right.
completely avoiding everything.
Yeah.
It's about understanding those triggers and finding ways to manage them.
So like for those common allergens, dust mites, what can we suggest?
Well, think about where dust mites love to hang out.
Okay.
Bedding carpets, soft furnishings.
Right.
You might talk to your patients about dust mite covers on their mattresses and pillows,
Okay.
washing bedding frequently in hot water, vacuuming regularly.
And for smoke, it's got to be avoiding secondhand smoke, right?
Couldn't agree more. Create those smoke-free zones at home, even if they don't smoke themselves.
Yeah, because that exposure can be a huge trigger.
Yeah. Now let's talk about medication management, a big part of self-management.
Okay.
We talked about quick relief inhalers and inhaled corticosteroids,
Right.
but there's an art to using these correctly.
Yeah, I've seen patients who just puff away at their inhalers.
Oh, I know, and you can tell the medication isn't going where it needs to.
Not at all.
That's why teaching proper technique is crucial.
Absolutely.
One thing you'll be showing them is the importance of slow, deep inhalation.
Okay.
And holding their breath for a few seconds.
Right, to let the meds get down there.
Exactly, to reach deep into the lungs.
I remember learning the 7-7-7 rule in nursing school.
Oh, yeah.
Inhale for 7, hold for 7, exhale for 7.
That's a great one to teach your patients.
Simple but effective.
And don't forget about spacers.
Oh, yeah. Especially for kids and older adults who might have trouble coordinating their breathing.
Spacers are like magic tunnels for your meds.
They help get that medicine right where it needs to go.
Right. Now, in addition to meds and trigger management, we talked about monitoring lung function with peak flow meters.
I love that, empowering patients with those tools, but we got to go beyond just handing them the device.
I completely agree. We need to give our nursing students the knowledge and confidence to teach patients how to use them.
So let's walk through a scenario. Say a patient is new to using a peak flow meter.
Okay.
How would you explain it in a way that's easy to understand and gets them to use it consistently?
I'd start by explaining that it's like a speedometer for their lungs.
Okay, I like that.
It measures how fast they can blow air out, giving us a snapshot of how open their airways are.
Gotcha.
I'd show them how to use it properly.
Okay.
Standing up straight, taking a deep breath, and blowing out as hard and fast as they can.
And then interpreting those readings, that's important.
Right. Each patient will have what's called a personal best reading.
Oh, okay.
The highest reading they get when their asthma is well controlled.
Makes sense.
We use that personal best to establish their green, yellow, and red zones.
So green means good.
Right, asthma is well controlled.
Yellow means caution.
Exactly. It's a warning their airways are narrowing.
They might need to adjust their meds or do something from their action plan.
And red means,
Emergency.
yes, seek immediate medical attention.
Okay, so how often should patients be checking their peak flow?
It depends, on the severity of their asthma and their individual action plan.
Right.
Some might need to check it daily, others only when they're feeling symptoms or during certain times of the year.
Like allergy season when things tend to be worse.
Exactly. And all this data can help spot patterns in their asthma control over time.
Really valuable information.
Absolutely, for both the patient and us to track progress and adjust the treatment plan.
This really shows how important nurses are in all of this. It's not just about handing over a device or a prescription.
Yeah.
It's about giving them the education, the support, the encouragement to take control of their health.
You hit the nail on the head.
So, triggers meds, lung function, anything else future nurses should be thinking about with asthma self-management. Well, we've talked a lot about the physical side of asthma,
We have.
but we can't forget about the emotional part either.
Oh, absolutely. That's a huge piece of it.
It's easy to get caught up in the technical stuff,
Right.
like treatment plans, medications.
Mm-hmm.
But at the end of the day,
Yeah.
we're treating a whole person, not just a set of symptoms.
Imagine living with that constant fear of an attack.
Oh, yeah.
The frustration of not being able to do everything you want.
Mm-hmm.
The worry about ending up in the hospital.
And, for some people, it even affects their self-esteem,
Yeah.
their social life.
Especially younger patients.
Right, like feeling self-conscious about using their inhalers around their friends.
It's tough, and as nurses, we have to be aware of that.
Yeah, we have to be sensitive to those feelings.
It's not enough to just ask about their breathing.
Right.
We need to ask how they're feeling.
Create that safe space for them to talk about their fears, their frustrations.
And sometimes just listening can make a world of difference.
Absolutely, active listening is so important.
And you won't always have the answers.
Right.
But if a patient is struggling, connect them with the right resources.
There are therapists, counselors, support groups out there.
A whole network of support.
And connecting with others who
Yeah.
are going through the same thing can be so powerful.
Yeah, support groups can provide that sense of community,
Mm-hmm.
reduce that feeling of isolation,
Right.
and offer coping strategies.
So we've covered a lot.
We have.
The physical stuff,
Yeah.
the emotional side of things.
It's all connected.
And the key takeaway for you future nurses,
Yes,
knowledge is power.
absolutely. The more you know about asthma, the better you can help your patients.
You'll be able to educate them,
Mm.
advocate for them,
Mm-hmm.
and really guide them through managing this condition. And it's not about just memorizing facts.
Right.
It's about taking that knowledge and using it to improve lives.
Turning it into action, into compassionate care.
Okay, so let's wrap up by going back to that question we asked earlier.
The one about designing a perfect asthma education program.
Yeah, if you could create that program, what would it look like?
Think about all the tools and resources we talked about.
Right.
What would you prioritize?
How would you make it engaging, informative, and empowering?
That's something for all you future nurses to think about.
Keep those creative juices flowing.
And remember, learning never stops. Stay curious, stay informed.
That's a wrap on our deep dive into asthma self-management.
We hope you found it helpful.
Until next time, keep breathing easy and keep those brains buzzing.
See you later, future nurses!